Hey, Dr. Stoker.
Hi, Quinn.
Can we talk about the sexier side of breast implants? What kind of profiles there are?
Sure, that's a common question we get, of course, and anybody who's thinking about breast implants. Maybe I should just start by showing you some of the difference. There's high profile in general, moderate plus profile, and moderate profile. So a high profile implant is something like this, okay? So it's very narrow at the base and it projects out a lot. This implant is typically best for somebody who's a little person with a little chest who wants to put a big implant on that chest. Because if it goes really wide, it's going to be out in their armpit. It's not going to fit their body well. Does that make sense?
It does.
Okay, so let's compare that to a step down is a moderate plus. Okay, it's a hybrid between a moderate and a high profile implant. So a moderate plus is a little bit wider and a little bit less projection. This is a middle ground for many patients. It's a lot less common for me to use a high profile implant than it is a moderate plus. The most common of all are the moderate implants. These are the broader ones here.
Oh yeah, significantly more broader.
Yes, and each patient, has a different breast shape, very importantly, different shape of their rib cage. And all of that needs to be put in the context of how much bigger does the patient want to be. So it's both the volume of the implant in total, and then how is that volume distributed between projection and width. It's very difficult for a patient to know which they want, but I think it's an important thing for them to bring up and discuss with the surgeon so that through measuring and communication and looking at photographs together, they can make the best choice for their implants.
Yeah. Do you usually show them all profiles in the room?
I do. Just as an example, kind of as I'm showing you, and I let them hold them. And I'm one of those doctors who I kind of love the consultation process, so I take longer than I need to, but I like to make sure they're really well informed and educated.
Yeah, no, it's super, I feel like, needed in a consultation to go through each type of profile, what it would look like. Can the patient get a good visual of what their profile will look like?
Absolutely, and we do that in several ways. One is by actually letting them hold the implant up against their body. It's not the most accurate way of doing it, but it's helpful. We also have sizers that they can insert within their bras to get a different perspective. And the third thing is that I like to do is to look at photographs with them. Hopefully nude photographs. They can show me what they like, show me what they're scared of or want to avoid, and I can show them what types of bodies are reasonably comparable to them. Because it might, if they like one thing but they can't look like that person, we might as well identify that as unrealistic for them, right?
Yeah, I feel like that's hard. You can definitely get in the pool of being unrealistic with expectations if they want a certain look and their body type is not. They can never get that type of look.
Yeah, it's definitely possible and something we always want to avoid.